This is the very first time we introduce our newborn, the Pan-Canadian Health Reform Analysis Network, and I see that as very propitious that the introduction takes place in a grand ballroom, so I hope that newborn can dance, and I also hope that what the newborn will have to say will be music to your ears. So let me start with saying that this is the Pan-Canadian Health Reform Analysis Network, PHRAN, in English, but it's also RPARS in French, le réseau pan-canadien pour l'analyse des réformes de santé. So the network really started with some frustration from most of the people who were here on the stage and some of the people who got together and decided to create that network. Frustration on something, well, you're perfectly aware of that the fact that Canada has a decentralized healthcare system, that we don't really have one healthcare system, but we have 13 or even 14 if we include the federal system healthcare systems, operating under one Big Ten, the Canada Health Act, which is pretty loose. So it means that really it's hard to describe what the Canadian healthcare system is. It's even harder to describe what's going on in the healthcare system in Canada. So typically that's the kind of frustration that is experienced when you're a member of an international network. So for instance, Greg Marchinen was the member of the European Observatory and was one in charge of writing the Health in Transition. CHEPA was in the last years of the Bertelsmann Health Policy Monitor, also the representative for Canada. And we had that same problem of how can we really describe what's going on in Canada. But there is another level of frustration, which is that we have, well, first of all, we don't really learn from the best. We don't really understand what's going on. For instance, if you're in Nova Scotia, you don't really know what's going on in Manitoba or Saskatchewan, and sometimes you simply, you miss great information or opportunities to learn about policy reforms that can be implemented in your province. You, as a health policy analyst, you miss opportunities to provide advice to policymakers in your jurisdiction. So that's one layer of frustration. And let's say the utmost extreme frustration is with the fact that we have a unique experience here in Canada because we have all these various provinces, different systems, but they all operate under a kind of a similar, at least the values are similar, the spirit is similar. So in that sense, we are in a much better position than our colleagues in Europe. We have that experiment in front of us, and we don't really exploit it, we don't use it because we are lacking an instrument, a tool to describe and to provide information or evidence on what's going on in provinces. So for that reason, we made a decision to get together, and as usual, when it is about depicting Canada, a group of 7 emerged. So here we have 7 contributors from 6 jurisdictions. From Nova Scotia, we have Ingrid Sketris, and Yukiko Asada. From Quebec, Amélie Quesnel-Vallée. From Ontario, Audrey Laporte. From Saskatchewan, Greg Marchilden. From Alberta, Herb Emery, and from British Columbia, Steve Morgan. As you can see, there are still a few missing jurisdictions, so we invite candidates, if you're interested in joining a network and you're not, you're in one of the jurisdictions that are not mentioned here, please join. There are also 3 members who are somewhat floating without any geographical affiliation, John Levis, Jean-Louis Denis, and myself. And so these 10 people are the network, in a sense. So the first thing we did when we met for the first time in September 2011 was to create an open access journal. This open access journal is called HRO, which stands for Health Reform Observer, and in French, ORS, Observatoire des Réformes de Santé. And the goal of that journal, so really in a sense, the network is the journal. The editorial board of the journal is comprised of the members of the network, and the main product of the network is the journal. So the goal of that journal is to provide Canadian and international decision makers and also health policy analysts with good evidence that is easily read. So in that sense, we want short contributions, we want short pieces of evidence on policy reforms. What we mean by reform, we mean it has to be different from interventions, and I invite you to consult our website to get all the details, and we can also discuss that after the panel presentations. So, but let's say in a nutshell, what we call reforms are really, it has to be more than an intervention. It has to be something that changes at the level of an entire jurisdiction, and it has to, so it can be a health region, it can be a province, it can be federal as well in some instances, but it has to be really more than one hospital or one, let's say, family health team. Another thing that we decided, another decision that we made was to create an open access journal in a sense that it would be free for everybody, free for authors. We don't charge authors. We don't charge readers, so it's free for everybody. We don't even charge reviewers, so it's perfectly free. And it's open in a sense also that we want the names of authors to be known by reviewers, and we also want the names of reviewers to be known by authors. And the last decision that we took was that the main goal of the journal is, first of all, to publish what I would call raw data. So in a sense, evidence pieces that are going to be standardized, that are going to follow a template that will make those pieces of evidence easy to read and also easy to compare, because the goal at the end is really to be able to be in a position where we can compare reforms and we can compare policy decisions or policy discussions across jurisdictions. For that reason, we need to have a standardized template, a standardized format to present those reforms. So the way it works is the following. First of all, we want to publish these what I would call the raw data or raw evidence on policy, the descriptions of policy reforms in various jurisdictions. These are short pieces, as you can see, 2,000 words maximum, and they are very descriptive. In a sense, the way it works is the following. You, as policy analyst or health services research, you work on something, something that is discussed or a reform that is implemented in your province. And what you want to do, you need to write some kind of background to describe the policy reform. What we ask you or what we suggest you to do is to make a little bit more effort and to put that background description into the shape of, 2,000 words following a template and submit it to Health Reform Observer, and you'll have a publication and we'll have a compendium. We'll be in a position to build that compendium of standardized description of reforms and good evidence on health policy reforms in the country. Then, more ambitious pieces are going to be comparative health reform analysis, longer pieces, 4,000 words approximately. These are going to be more analytic articles. They may include cross-issue, cross-jurisdiction, comparisons of Canadian health reforms. We even invite comparisons with reforms in other countries. Then there are going to be letters of opinions and reaction. We invite reaction, for instance, to our HRA. So if you disagree with something that you saw in the journal about reform in your jurisdiction, you're more than welcome to publish a reaction to that. And there are going to be also network editorials from PHRAN, from the members of the editorial board. Last thing that I wanted to say I wanted to emphasize, which is really important, is that even though there is a central network in a sense that is going to run the journal, there is no central decision on what is to be described. It's really, analysts in each province who find that something really interesting is taking place, who are welcome to describe and to write the piece and submit it to the journal. So there is not going to be something that says we want to know everything that is going on in terms of, let's say, physician payment schemes in all provinces. But if something, it's more event-driven. If something really interesting is taking place in one province in terms of physician payment scheme, then we want to learn about that, or we invite a contribution on that. So as I said, we want to have a template, some kind of we want all the descriptive pieces to follow the same format so that we can, it's easier to compare across reforms. I don't want to, again, we can discuss the framework, but it's really, it's a health policy template, it's a health policy format. What we want to learn about the goals of the reform. We want to learn about the factors that can explain how the reform came onto the agenda, how the decision was made to implement or not to implement the reform. We want to know about the context of the reform and the historical context of the reform. We want to know about also the strengths, weaknesses, opportunities, and threats of the reform. And One last word before I introduce the next speakers is about the review process. It's not about a review process that would be about rejecting or accepting the piece. Of course, the submissions have to be rigorous, but really what we want the reviewers to do is to provide guidance and to provide help to improve the quality of the pieces. Now, because it's always better to provide illustrations than trying to describe what is going on, we will have 5 presentations, 4 illustrations, and 1 discussion of a provincial network. So the 4 presentations it's not ladies last, but it's simply from west to east. So we are going to start from Greg Marchildon, who is going to describe lean management in Saskatchewan's health system, which is the first piece published, and the first and only piece, I have to say, published on the journal. Then David Rodeler from the University of Toronto will present a piece on personal support workers in registries in Ontario. Amélie is going to present on the delisting of medical imaging in Quebec. And Catherine Philbeck is going to present on legislating interprofessional collaboration in Nova Scotia. And as I said, Yukiko is going to describe 1 example of how PHRAN can expand based on the Nova Scotia sub-network. And one very last word, you will see that it's a very democratic network because we use all kinds of tools, the very austere PDF, LaTeX based, but also some Prezi, very fancy presentations that are going to come next. Thank you very much.